Hello, and welcome to Motivational Interviewing 101. Motivational interviewing is a client-centered counselling technique involving collaboration with a counsellor to guide motivation to change and maintain health behaviours by exploring and reducing any ambivalence or barriers to change. But how should we, as future health practitioners, implement this? To help illustrate the principles and practice of motivational interviewing, I want to introduce you to a particular case study. Meet Becky. Becky is a 22-year-old college student. Becky was an active child and teenager, but since arriving at college, her busy study and social schedule has now taken priority over exercise. Becky has noticed that her fresher 5 has turned more into a third year 15. Her mental health has also been declining recently, with disruptions to her sleep and difficulty concentrating in her lectures. If she maintains this sedentary lifestyle, she is at risk of long-term health implications. Physical activity has been recognised as a great way to stay healthy, lose weight, and improve sleep quality and mental health. But how can we use motivational interviewing to help Becky realise the importance of engaging in long-term exercise participation? The key component of motivational interviewing is that it is client-centred. In this case, it needs to be Becky who identifies her ambivalence towards exercise and ultimately generates her own motivation to engage in and maintain long-term physical activity. Throughout our consultation with Becky, we need to consider the 4 principles of motivational interviewing, known by the acronym RULE. We must resist the writing reflex. As counsellors, we must be careful not to tell Becky what she should do and why. Although counsellors are naturally in an expert role, we must maintain a client-centred approach and resist the urge to project our own thoughts about what we believe is best for Becky. We should instead, understand the client's motivation. What motivates Becky? What are her interests, concerns, and values? Therefore, it is important to listen to Becky. What is Becky going through? What does she have to say? Listen to her with empathy. As practitioners, we should keep in mind that good therapeutic practice often dedicates equal amounts of time to listening and talking. And ultimately, we must empower Becky to explore and make her own choices. What types of exercise might Becky be interested in trying? In conjunction with these key principles, it is important to understand the 3 components which underpin the spirit of motivational interviewing. The first being collaborative partnership. As a counsellor, we should work with Becky to resolve her ambivalence through joint decision-making, where we acknowledge Becky as the expert in the situation. If Becky expresses a particular interest in yoga, we might suggest she attend a couple of yoga classes a week at her local gym. But if Becky says she does not yet feel comfortable in a group exercise setting, we may work together to find a better alternative. The second principle underlying the spirit of motivational interviewing is evocation. As a counsellor, we must activate Becky's motivation for change by evoking the reasons why she wants to change and elicit change talk. Change talk is encouraged through asking questions about the advantages and disadvantages of change, about her optimism for change, and her intentions to change. Becky, what do you think you will gain from increasing your physical activity? What do you feel is holding you back? How do you feel about exercising? The third spirit of motivational interviewing is autonomy. We need to encourage Becky's self-direction in her exercise journey. She must feel that she can exercise choice. For example, she should choose the types of exercise she would like to engage in, when she would like to exercise, and the goals she would like to achieve. This is underpinned by the self-determination theory, as autonomy is one of our key psychological needs that, when satisfied, increases the chance of intrinsic motivation. Intrinsic motivation is indicative of more long-term behaviour change, thus is important for maintenance of an active lifestyle. Now that we understand the principles and spirit of motivational interviewing, it is helpful to recognise the theory behind the process. This can be effectively explained through the trans-theoretical model, which details the stages of behaviour change. There are 5 stages of behaviour change in the trans-theoretical model, which I will relate to Becky's journey and provide recommendations for counsellor practice at each stage. Number 1, the pre-contemplation stage. This is where Becky is not ready to initiate change. She's become comfortable with her college routine and she can't see a feasible way to incorporate regular physical activity. Here, as counsellors, we should try and raise doubt about her reluctance to change and help Becky realise the problems with her current behaviour. Next, she enters the contemplation stage. She has realised the importance for change and she begins to weigh up the pros and cons of initiating this change. Here, we can encourage Becky to tip towards change by helping her explore her ambivalence, identify and dispel any reasons for not changing, and increase her confidence in her ability to change. You say you do not have enough time to exercise, Becky, but you've also mentioned that you would like to cut down on your screen time. Would it be possible to replace 30 minutes of screen time with 30 minutes of exercise? Then third, Becky enters the preparation stage. She now feels ready to change, so we help her engage in goal setting so she can begin to develop a realistic plan. Becky doesn't have any uni classes on Tuesday, Wednesday, and the weekend, so she will aim for 30 minutes of exercise on those days. Then Becky enters the fourth stage, maintenance. This is where she transitions to long-term, regular physical activity, which we can help her achieve by implementing strategies to prevent relapse. Becky values social interaction, and she worries that she is missing out on gatherings and social time at college if she is at the gym. To prevent relapse, she's decided to team up with a friend and go to the gym together so she gets to have social time as well as helping minimise the effects of FOMO. And then 5, we must consider the relapse stage. This is okay, and it is a natural part of behaviour change. We should normalise relapse, but help Becky renew the process of contemplation and action without becoming too demoralised. After a big week with 3 assignments due, Becky just didn't have enough time to exercise. So we have to reassure her that sometimes life happens, and it is important to prioritise her uni work. However, we remind her of how good she was feeling prior to relapse and how it was helping with her organisation and sleep schedule. So we encourage her to reinstate her exercise habits to help with her routine and well-being. After looking at the stages of change presented by the trans-theoretical model, we can start to see how motivational interviewing practice is delivered. But what are some other specific techniques essential to this practice? This can be best understood through the acronym OARS. O, open-ended questions. These ensure that Becky does most of the talking so she can explain and guide herself and the practitioner on what she really cares about. For example, instead of asking, is physical activity something you value? We should instead ask, could you explain some of your key values in life and whether you think any of these are not being fulfilled? A, affirmations. These act to compliment, appreciate, and convey understanding to Becky and support her through her process of change. After meeting her successive approximations of goals, we affirm her by saying things like, "Great job! Your commitment and determination is really admirable and it's paying off." R, reflection. This is achieved by rephrasing to capture implicit meaning. This can encourage exploration and increase desire for change. So you enjoyed your yoga class, Becky. How did it make you feel afterwards? And what did you enjoy most about it? Then S, summarising. This helps demonstrate a mutual understanding, empathy, and highlight any potential discrepancies in Becky's motivation. Becky, it sounds like this week you've been feeling down and lacking motivation. We have all been there, and I want you to be gentle on yourself. But remember how good you feel when you move your body and how much you said it helps your mental health. Hopefully by now, you have a good understanding of the principles, theory, and practice involved in motivational interviewing. But how effective is it really? There can be barriers to effective implementation of motivational interviewing, time pressures, and that general difficulty embodying principles when in a natural position of expertise as a therapist. Yet, this approach is generally solid in predicting increased motivation to change. Studies have shown that motivational interviewing is equivalent in efficaciousness to other therapeutic techniques such as cognitive behavioural therapy and pharmacotherapy, both of which have substantial empirical support. Motivational interviewing is particularly efficacious for health-related behaviours, such as increasing exercise, also smoking cessation, safe sex practices, and adherence to treatment. Therefore, through motivational interviewing, we can help people such as Becky increase their motivation to initiate change and to adopt behaviours to improve their overall health and well-being. Make sure you try out these techniques to help yourself become a better motivational interviewer.